My name is Shtern. I'm a physician and president of the AdMeTech Foundation, a nonprofit organization leading regional, national, and global programs in prostate cancer education, research, public awareness, advocacy, and clinical care equity. My gratitude to Representative Giannino for making this 5th annual Joint Prostate Cancer Awareness event possible. The focus of my talk is on AdMeTech Foundation's history and our prostate cancer program, established to lead cutting-edge advances in patient care, to bring them to Massachusetts men and eliminate health disparities. History of AdMeTech Foundation and its programs is closely tied with my own professional and personal history. Since 1990, I was head of Diagnostic Imaging Research Branch at the National Cancer Institute. In this position, I was leading development of national and international policy and related strategy and programs for the National Institutes of Health, NIH, Department of Health and Human Services, and U.S. federal government. Our priority focus was on the advancement of breast cancer imaging. We created digital mammography, breast MRI, advanced ultrasound, and molecular imaging for improved patient care. We also work on teleradiology for image transmission so that we could bring world-class expertise to underserved rural and remote communities. As of early 90s, most women had blind biopsies. Precision imaging made it possible to see where suspected tumors were located and develop stereotactic biopsies where biopsy needles are guided with precision to suspicious areas. As of early 90s, women with breast cancer have radical surgery or mastectomy, where the entire breast is removed. A procedure performed in operating rooms causing physical, emotional trauma, pain, suffering, and deformity of women's bodies. Precision imaging made it possible to proceed with minimally invasive surgery or lumpectomy, where we identify and remove only a part of the breast tissue containing tumors. These minimally invasive procedures are performed in outpatient clinics with minimal complications, pain, suffering, and costs. As of early 90s, many women, particularly Black women, were diagnosed with breast cancer in more advanced stages and were more likely to die. With digital mammography and MRI, all women are more likely to have early detection of breast cancer, critical for saving lives. Today, Black women have a nearly equal chance of dying compared to white women in many communities, particularly in a state like Massachusetts with its universal access to care. In 1996, while our breast cancer programs were well underway at NCI and NIH, I brought together the key leaders of government, medicine, and industry to outline new strategic priorities. This expert recommended prostate cancer as the next priority focus for several reasons. First, prostate cancer is the most common major internal cancer among men. It is as common among men as breast cancer is among women. Prostate cancer strikes 1 in 8 men. Breast cancer strikes 1 in 8 women. Second, prostate cancer screening with blood test PSA was successful in identifying men at risk of losing their lives and in reducing mortality, or the likelihood of men dying of prostate cancer. However, men did not have accurate diagnostic tools that would make it possible to sort out if an abnormal screening result is due to false alarm or due to a life-threatening prostate cancer. With no accurate diagnostic tools, many men had either insufficient diagnosis and treatment of aggressive prostate cancer with dangerous consequences, or on the other side of the spectrum, they had overdiagnosis and overtreatment of benign and harmless prostate cancer, leading to unnecessary invasive procedures with related life-altering complications and costs. Third, treatment of prostate cancer, such as radical surgery, was highly invasive and traumatic, leading to a prolonged hospitalization, difficult recovery, and the unacceptable level of life-altering complications. Fourth, prostate cancer is a leading health disparity. Black men are 2.5 times more likely to die compared to white men. We did not see this level of disparities in breast cancer even early in my career, in the 80s and 90s. Finally, in sharp contrast to women with breast cancer, men did not have accurate imaging, leading to blind biopsies and treatment. Our work in breast cancer imaging created a blueprint for transforming prostate cancer care and eliminating health disparities. At about the same time in 1996, I had a personal experience that left me shaken. A leading clinical expert in Massachusetts, chosen by me, saw my father and determined that he had a benign and common prostate condition. However, when my dad had an invasive procedure for this condition, he was found to have prostate cancer. I was shocked that a leading expert in a world-leading hospital did not have diagnostic tools to make accurate clinical diagnosis. This experience transformed my professional interest in prostate cancer into a personal mission to improve early detection and treatment of this disease for all men and to reduce health disparities in Black men. If we made a difference for women with breast cancer, we could make a difference for men with prostate cancer. I organized other leaders of medicine, and we approached NCI and NIH, key leaders, in a hope to see an increased government investment in prostate cancer research. Unfortunately, in spite of our joint track record and a year-long effort, we did not succeed in convincing federal government. In response to the lack of support from federal government, by late 1997, we established AdMeTech Foundation with the mission to end blind patient care and create the future of image-guided, minimally invasive diagnosis and treatment of prostate cancer. Since 1997, we have been leading pioneering research that resulted in creation of precision MRI, molecular imaging, and other imaging tools that transform prostate cancer care. In 2005, we initiated a large-scale national public awareness campaign that is Manogram, prostate imaging for men. In 2009, we had the first annual Prostate Cancer Awareness Day in Massachusetts State House and proceeded to create a new model in public education. In 2011, as the result of our advocacy, Massachusetts legislature had set up a historic precedent by recognizing prostate cancer as the central healthcare problem in men, a leading health disparity and public health priority. By 2013, Massachusetts legislature established a prostate cancer program. It started with a research project that was seminal in making MRI a new standard in patient care for guiding biopsies and treatment. Since 2014, we expanded our efforts in public awareness. Over the last 6 years alone, we reached over 71,000 people. In 2016, we established annual global summit on precision diagnosis and treatment of prostate cancer, a medical educational event. In 2021, we launched Prostate Cancer Equity Resource Project, I'll describe later. And in 2023, we created an international working group in minimally invasive image-guided treatment to expedite development of strategy for expedited research and implementation of this new approach to clinical intervention. Our statewide program in prostate cancer created a Massachusetts model of national and global leadership in public awareness, medical education, research, and health equity. AdMeTech is leading this program in cooperation with multiple organizations, including American Cancer Society, leading clinical experts, and branches of the NAACP and Latino Health Insurance Program located across the state. Our primary focus is on high-risk men, Black, Hispanic, and Latino individuals, and all men with family history of prostate cancer and increasing age, 50 and older. The centerpiece of AdMeTech's medical education is annual Global Summit on Precision Diagnosis and Treatment of Prostate Cancer. Our summit has been recognized as a seminal event in shaping the state-of-the-art and future vision for patient care. Our summit brings together the key international experts representing every clinical field to review the best emerging clinical practices and research needs and priorities. There is not a corner of the world that has not been represented at this event. The latest 9th annual conference took place only in September 2025, several weeks ago. Our summit demonstrated that early detection saves lives and eliminates health disparities. With early detection of prostate cancer, every man is alive in 5 years. In sharp contrast with late diagnosis, when cancer is spread outside of the prostate to other organs, only 28% of men remain alive at the same time. Early detection is particularly important for high-risk individuals, including any men with family history of prostate cancer or Black men who are twice as likely to die as white men. In prostate cancer, screening with blood test called PSA is the best tool we have for prevention and early detection, critical for saving lives and reducing health disparities. If we look at the reduction of mortality per year, PSA blood test is the most successful screening tool we have had in the history of cancer. It is important for men to take charge of prostate health. To do that, it's important to know your risk factors, such as Black heritage, family history of prostate cancer, particularly when your brother or father had this disease, and increasing age, 50 and older. You can assure early detection during annual visit. Ask your doctor to discuss if PSA blood test and digital rectal exam are right for you. You need to talk to your doctor starting at the age of 40 if you have risk factors I just described, or at the age of 45 if you do not have these risk factors. Before screening, it is important to avoid exercise or sex, which may impact your testing results for at least 2 days. After screening, you need to ask your doctor if your test is normal or if you need to see a prostate cancer expert for further evaluation. It was interesting to hear at our summit from multiple experts that of all diagnostic tools, imaging has become the game changer for men, resulting in improved diagnosis and treatment of life-threatening prostate cancer, while decreasing unnecessary biopsies and treatment. For example, in this slide, MRI shows prostate cancer lesions and guides biopsy needles with precision. AdMeTech has led research and development and large-scale implementation of prostate MRI since 1997. In 2013, Massachusetts legislature funded clinical trial of prostate MRI, which produced groundbreaking data that were presented at the summit of 2016, about 9 years ago. 6 months later, by early 2017, MRI was recommended as the new standard of patient care prior to biopsy and treatment. Similarly to breast cancer, precision imaging such as MRI paved the way not only for precision biopsy, but also for image-guided, minimally invasive treatment for prostate cancer. Some call it male lumpectomy. Similarly to lumpectomy in women, these minimally invasive procedures remove only cancer instead of the entire prostate, are performed in outpatient clinics with reduced complications, discomfort, and costs, and are expected to replace radical surgery in many men. Our summit highlighted the importance of MRI in Black men who are likely to have lesions in the front part of the prostate that are difficult to find by physical exam or standard blind biopsies performed without accurate imaging. More recently, molecular imaging has been shown to play an important role in staging of prostate cancer, including presence of metastatic spread outside of the prostate and detecting return of prostate cancer after treatment. For example, molecular imaging with PSMA has become available at the Dana-Farber Cancer Institute since August 2021. On the left, we can see a regular bone scan study that shows no metastatic spread. However, on the right, in the same man, molecular imaging shows multiple metastatic lesions. This information is important for selecting appropriate treatment. We are proud to have led research and development of molecular imaging since 2001. AdMeTech's leadership in advanced imaging made it possible for us to help men get access to high-quality MRI and molecular imaging before these important diagnostic tools became available in Massachusetts. Our summit concluded that equal access to high-quality care is the key factor in improving patient outcomes for all men and eliminating health disparities in Black men. It is particularly important now with so many novel diagnostic and therapeutic approaches, ensuring high-quality, personalized patient care. Without equal access to these advances in patient care, we will see a widening gap in health inequalities, including survival and mortality. Consequently, AdMeTech launched the Prostate Cancer Equity Resource Project in Massachusetts in collaboration with Mass General Brigham, UMass, and other clinical institutions with the mission to save lives and deliver high-quality care for all. More recently, experts from Beth Israel Lahey joined us. Supporting organizations include Latino Health Insurance Program and multiple NACP branches located across the state. Any Massachusetts man age 40 and older is welcome to participate. Our priority focus is on Black, Hispanic, and Latino men who are at high risk of prostate cancer, delayed diagnosis, poor quality care, and death. Our goal is to expedite access to leading experts who use the most advanced approaches to screening, diagnosis, and treatment available today, and to support men every step of their medical journey. This program helps men to find an expert for the initial or a second opinion in person or virtual visits. We believe that in Massachusetts, with its leading hospitals and universal access to care, our prostate cancer equity program will be able to eliminate health disparities. Experts of the Prostate Cancer Equity Program can address any questions about prostate health, from assessing an individual healthy man's personal risk of cancer longer term, to informing men about all available options before and after screening, biopsies, and treatment. We are committed to supporting men during every step of their medical journey to ensure that no man is left behind or struggling alone. To achieve this goal, we created a streamlined process of patient referral and care, reflecting how doctors involved in this program would like to take care of our families and friends. This process consists of several components. First, AdMeTech Foundation's team collects basic information and matches individual patients' needs with the appropriate state's experts for clinical care. Second, a clinical organization designates a patient navigator to expedite a medical visit and related needs, including scheduling, registration, transportation, financial and insurance assistance if needed. Third, if an expert recommends any next steps, AdMeTech's team and patient navigator work with men on the appropriate follow-up, such as, for example, additional testing or treatment. I'd like to provide a few recent examples of how Prostate Cancer Equity Resource Project has been making a difference. In December 2024, Martha's Vineyard NAACP asked us to help an older Black man who expressed a lot of confusion and concerns about his care. AdMeTech staff contacted Dr. Einstein, present here today, at Beth Israel Lehi, who agreed to provide a second opinion. In February this year, this man and his wife had a visit with Dr. Einstein, who provided a clinical consultation and contacted the original clinical care team to ensure a coordinated approach. Next month, in March 2025, patient and his wife described that as a direct result of Dr. Einstein's consultation, they understood their situation for the first time and became clear about the next steps. The second example involves George Brickhouse, who in December 2022 took part in the virtual meeting of the PCE resource organized by Steve Bernard, immediate past president of Brockton NAACP. During that meeting, George expressed the lack of trust in his care and difficulties in scheduling prostate MRI recommended by his doctor. We got concerned, and after the meeting contacted Steve and asked him to explore with George if he would be interested in our PCE resource. In early 2023, George contacted us and we suggested for him to consult with Dr. Kwok Ding Trinh of Mass General Brigham, who can ensure the best of class care, including high-quality MRI. George has been so happy with his care that he became an advocate for our prostate cancer equity resource. In late 2024, Dr. Trinh moved to Pennsylvania due to academic promotion. In March 2025, per George's request, we referred him to Dr. Adam Feldman, another leading clinical expert at Mass General Brigham and our partner at that clinical institution. Emma Coyer serves as a manager of the Prostate Cancer Equity Program. Emma is assisted by Erin Roberts, program coordinator, Craig McClay, patient educator, and other members of the AdMeTech Foundation's team. We serve as your individual patient care advocates. When you come to us, Emma will work with you, our team, Mass General Brigham, UMass, Beth Israel, and other clinical partners to expedite medical visits and address any needs you may have. Together with clinical experts, we empower each man to make informed choices in patient care that are right for him before and after screening, biopsy, and treatment. If you have any questions or need assistance, please contact Emma by phone 617-523-3535 or by email coordinator@admetechfoundation.org. Thank you for your attention.